Hello and welcome to another lecture on the gastrointestinal tract. The histology component of this system will be covered. My name is Dr. Eric Aidoo with the Department of Anatomy and Cell Biology of the School of Medical Sciences, University of Cape Coast. Thank you for being my guest. So, this learning objectives, I expect that students will be able to basically appreciate the various sections of the gut tube, and then also be able to name the parts as far as micrographs are concerned. So you should be able to tell how the components of the oral cavity, be it the tongue, the papilla or taste buds, salivary glands. Then you look at the general architecture of the GIT, that is mucosa, submucosa, and then the muscularis, as well as the serosa or adventitia. Okay, and then also you should be able to tell the differences in these regions when you are giving micrographs, all right? So you should be able to explain how they differ in the oral cavity, pharynx, esophagus, stomach, and intestines. Know the histological differences in the upper, middle, and lower portions of the esophagus, because these, as we see, are different. Should be able to recognize gastric glands, cardiac glands, and pyloric glands of the stomach. If you haven't watched the video on the endocrine glands too, you can look at that. Be able to recognize gastric glands, identify their constituent cells, and know their secretory products. As part of introduction, we know that the gastrointestinal tract or the alimentary canal begins from the oral cavity, goes through the pharynx, all right, and then through the neck region to the thoracic region, and then the abdomen. So you have the esophagus, which traverses both the cervical region and then the thoracic region, and then into the abdominal cavity. Then you have the diaphragm, which we'll look at when we are doing respiratory system. You have accessory organs or structures that aid the functions of the alimentary canal. So the liver is one of them. You look at the pancreas, the gallbladder, among a few others. So this is basically what we are going to cover. Now, you have the gut divided into three main sections, okay? You have the foregut, midgut, and the hindgut. Now, we can liken the alimentary canal to a musculo-membranous tube, which is about 9 meters long, okay, which extends from the mouth to the anus. So it has some muscle components and also some membranous components, okay? It's lined by a mucous membrane. Okay, so that's the membranous aspect we are talking about. So basically, this is the tube you are looking at as the stomach, and then you have the small intestines here, and then you have the large intestine. That's the gallbladder in green. Now, I always show this picture when I teach this course, because if you look at a 9-centimeter tube, okay, being carried by this small abdomen, which is not devoid of other structures, because the abdomen also has a very huge liver, okay? So when you just bend down and look at your abdomen and see how small it is, and you have a 9 centimeter, a 9 meter sorry, a 9-meter long structure in there. That should tell you that there should be some packaging experts, okay, to have achieved this. All right. So we usually liken it to if you are the type who struggles with figures like I do, then pictorial representations will help. So using the tennis court, for instance, will help you to appreciate how long 9 meters will actually cover. Okay, so from one end to the other, that's how long the tube is. And if you walk from one end of the tennis court to the other, and you ask yourself if there's a tube that long, because even the net that you are playing over is not as long as the whole tennis court, and yet folding this net into your abdomen will even be a problem. So how much more one which is longer than this? Okay, so it tells you that a lot of foldings, have gone on. A lot of surface area to volume ratio, component has been enshrined into this design to make sure that you have this in place without having any issues walking about, okay, in town. Else you have this long tube, drawing a lot of energy whilst you walk. And not to add insult to injury, it would have been moving about in any direction when you jump or fall. So again, this is even strengthened by what we call mesentery that hold these structures in place so that your stomach and intestines don't move onto the left or upwards or downwards when you also move accordingly, right? So that is very nice to appreciate. Yeah, so that's for your emphasis. Okay. So we look at the general organization and architecture. We will see that you have the mouth or oral cavity, which we will cover. And therefore, this lecture is going to be in parts. Okay, so this is part 1. And then I'll do the other parts so that we have the whole complete, lecture as we go on. You also have the pharynx, esophagus, stomach, small intestine, large intestine. The function basically, as you would appreciate, is that it's for ingestion and then mastication, peristalsis, digestion, absorption, and then egestion. Sometimes you forget the last bit of it as being a function of the digestive system. So if we take a vertical section through the tube, okay, you are going to see something like that. So that's the lumen inside there. Then the first structure you see, surrounding the lumen will be the mucosa. Okay. The mucosa is made up of 3 basic structures. That is the epithelium, which is the first, followed by the lamina propria, which is a connective tissue. Okay. And then you have the muscularis mucosa, which is made up of some smooth muscles. Okay, so this is how the basic organization of the gut is organized. So take it from this point, okay, gradually. Mucosa. And once you have a mucosa, then there will be something below the mucosa. So we call that submucosa, okay? And within the submucosa, you have glands, which we call submucosal glands. You have blood vessels. You have nerve plexuses, okay? If you remember your lecture on epithelium very well, you appreciate that it is avascular, okay? So its life is dependent on diffusion of substances that emerge from the connective tissues below the epithelium, okay? So some of these are supplied through the submucosa before they even get to the connective tissue, the lamina propria, okay? Then it will feed the epithelium. So the epithelium, okay, can also have some surface modification. Again, this was covered in the lecture on epithelium. So you can see that you may have either finger-like projections, all right, that could be villi, microvilli, or cilia, depending on which region of the body you are talking about. Okay, you don't have cilia in the tract here, the digestive system. We have villi and microvilli. So you can see the nerve plexuses, and the nerve plexuses are there because they need to innervate some muscles. Okay, so there are smooth muscles within the gut, and when we take the esophagus, as we see later on, it even has some skeletal muscles at some point. Then we come to the muscularis mucosa. Okay, the muscularis mucosa, which we commonly call the inner circular outer longitudinal muscle. So you have this inner circular outer longitudinal. In between the two, you have nerves that supply these muscles. And because the nerves are found within the muscles and also linked to the digestive system, we call that myenteric. So my as in muscle, enteric has to do with the digestive system. Then you have serosa or adventitia, depending on whether the tube is suspended, okay, in the abdomen or is connected to a dorsal body wall by a mesentery. Then you have adventitia, okay. Then within the mesentery, you have blood vessels passing through, okay, to supply the structures. Then it's important to know that once the gut has been divided into 4 mid and hind, it means that they have a particular source or origin, okay, embryologically. So the foregut should be able to define itself by giving certain structures that the others cannot give, okay, like the midgut will not give. Otherwise, there will be no need to even divide them, okay, into these stages. So you have the pharynx, lower respiratory system, esophagus, stomach, upper half of the duodenum, liver and pancreas, the biliary apparatus. All these are derivatives of the foregut. Okay, we will cover this in the embryology lecture. And because they are linked to the foregut, they are supplied by a particular artery, okay, or blood vessel known as the celiac artery. Celiac artery. All right. When we do the embryology, you see the origin of that. And derivatives of the midgut will therefore be the other half of the duodenum that does not form part of the foregut. Then you have jejunum, ileum, cecum, appendix, ascending colon. Okay, so the colon is now coming into presence. Then you have the right 2/3 of the transverse colon. So ascending colon and then transverse colon, which means that the 2/3 means that you are dividing the transverse colon into 3 parts, and you are taking the first 2 on the right, okay, on the right of the individual, standing in an anatomical position, not as you facing the person. So all organs derived from the midgut are supplied by this particular artery, superior mesenteric artery. Remember, for the foregut, we had the celiac artery. So this is superior mesenteric. If this is superior mesenteric and we are in the midgut, then you can guess, what do you think will be the artery that will supply the hindgut? That should be what? Inferior mesenteric. Okay, so that is the emphasis here. So where would the inferior mesenteric supply? Which structures? The derivatives of the hindgut will be left 1/3. Remember, we took the first 2/3 of the right part of the transverse colon, so we'll be left with just one part. And that will fall within the hindgut. Then you go to descending colon, the S-shaped colon, which is the sigmoid colon, and then the rectum, and also the superior part of the anal canal, the epithelium of the urinary bladder and parts of the urethra, okay, are also derivatives of the hindgut. All right. Even though we are not covering this in this lecture, there's some embryologic, common source of these structures. All organs derived from hindgut are supplied by the inferior mesenteric artery. Okay, so the small intestine can be divided into the duodenum, jejunum, ileum, large intestine, cecum. You have the ascending colon, transverse colon, descending colon, rectum, and then the inner canal. So when we take the oral cavity, we will see it to have, an aperture, okay, known as the vestibule, okay, the area outside the teeth, okay, and then you have the oral cavity proper. So the aperture, the opening, the entrance, okay, which is outside the teeth. So you are talking of this region, and then that's where you have the frenulum, okay, of the lip. So you have the superior labia frenulum and then the inferior one. Right? Then the gingivae, gums of the teeth and the teeth itself. Obviously, you expect to have some orifices, okay? So glands are open into the oral cavity to secrete some products, okay? Like the salivary glands, you expect to have some of them there. And obviously, sublingual, submandibular glands of the salivary gland will also, make their presence known. Then also you have this important part which we usually gloss over, the soft and hard palate, okay? Especially the hard palate. When you have an infection in the mouth, you have a lot of, inflammation here, okay? And it doesn't feel comfortable at all, the hard palate. You feel some globular ridges there with your tongue, okay? So sometimes a child who is teething, you see these things manifest. And then also very important structure, the tonsils, okay? Again, that also becomes inflamed and very conspicuous during oral infections, okay? Then you also have muscles, okay? Different types in the tongue and then in the mouth. So in the tongue, you have most of the muscles with the name glossus, okay? You have this arch, the pharyngopalatine arch, and then glossopalatine arch. Then this uvula is what stands in the midline and divides the oral cavity into a left and a right portion. Okay. So how many teeth do you have in an adult mouth? It should be common, okay? And you should be able to tell that you have the incisors, canines, premolars, and then molars, okay? I put this question there because somebody went for an interview and was asked about how many teeth the adult has, and he said 36. So think about the correct answer. Okay, we can't talk about the oral cavity without talking about the tongue, okay? The very important component of the digestive system and its accessory structure, which we sometimes ignore, but plays a very, very vital role. It tells you whether you are eating a salty food or a sweet or sour, food. So on the tongue, you have so many projections called papillae, okay? And it's within this papillae that you have the taste buds, okay? So what you usually see grossly on the tongue, those pointed things are not taste buds. They are actually papillae, okay? And you have different types of them. So you can have this one at the anterior portion of the tongue. You have the fungiform papillae, okay? The name is given in relation to the fungi, okay? A type of fungi, the mushroom, the way it looks like, okay? So fungiform papillae. You have the taste bud within it. Then you can also have this one, which is a little dorsal to the let me say posterior to the fungiform, and a little medial also is the filiform, okay, which has pointed edges, okay, at the tip. Then you have the one at the very lateral part of the tongue, the follate papilla, okay. Follate is a Latin word that describes leaf, okay, anything leafy, okay. So folic acid, for instance, is a folate kind of um, acid. The description is from leafy vegetables. And have valid, okay. I always use the name, the first letter of this name, valid, the V, to describe it. So you can see it's in the shape of a V, so it inclines, okay, more than that of the fungiform one. So sometimes you'll be confused about how the fungiform looks like and how the valid also looks like. Then you know that the tongue can be divided into three, portions equally, okay? And the first two we usually call anterior two-thirds, and the last, the one which is posterior, we usually say the posterior one-third. And it is having this divisible landmark here, the sulcus, terminalis, okay? And when we do embryology, you see why you have the sulcus terminalis and why you have the foramen cecum and these divisions, okay? So that the innervation of the tongue is even different. So anterior two-thirds will be innervated by the facial nerve through the chorda tympani, okay? Yeah, that is for taste. So you look at that and you move on. So here taste anterior two-third, cranial nerve 7, posterior one-third is there for glossopharyngeal, the muscles of the tongue by the hypoglossal nerve. Okay, so the salivary gland. Imagine a life without saliva. Your mouth will be so dry. Your tongue will be uncomfortable to live in that house. Okay, it's like living in a house with a deadly partner. You won't be comfortable. So the tongue, you need lubrication. The food that you are eating has to be lubricated. Okay, otherwise friction will be too much for the tongue and the rest of the mucosa of the mouth to bear. So you have these salivary glands. One of them we will tackle first, the largest, which is the parotid gland. Okay, it's located here. You also have the submandibular, that's below the mandible, and you have sublingual below the tongue. Okay, and the parotid gland secretes a purely serous secretions. Okay, and then the submandibular is mucous, and the sublingual is seromucous. Sometimes you read from book that submandibular has both serous and mucous, okay, but it will have more of the serous than the mucous. Then sublingual also has a mixture of serous and mucous, but more of the mucous than the serous, okay. So submandibular will have more serous than mucous, and then sublingual will have more mucous than serous, okay. You break it down as we look at micrographs. So if you want to look at a typical structure of a salivary gland, okay, this is what you see. So this rounded portion is the main factory where all the machines for manufacture, okay, is situated. All right, so all these are machines, okay. We call them secretory cells, okay. In this case, it is labeled as a signer cell because of its shape, okay. There are times you have tubular, secretory portion, so you won't call that a signer. But mostly you have a signer cells in secretory, units. All right. Now, superficial to the secretory cells or the sinus cells, you have these smooth muscle myoepithelial cells. Okay. Then you have the basal lamina or basement membrane. As I always caution students, don't say basal membrane. It's basal lamina or basement membrane. Then you have this lumen. So any product that is secreted by these cells will be pushed into the lumen here by contraction of the myoepithelial cells. Okay. Then once they have nowhere to pass because there's contraction, they will be forced to pass through this lumen towards the outer portion. Okay. Now the neck here between the secretory portion and then the duct, major duct, is the intercalated duct. Okay. All right. And you also have myoepithelial cells extending to the intercalated duct. You don't find that in the striated duct. Okay. And it is characteristic to note the shape and size of the intercalated duct lining epithelium. Okay. So from here, you can see there is more squamous. Okay. Yes. The best you can describe this will be maybe low cuboidal. Okay. And when you come to the striated, they are columnar. Okay. So note that for the striated portion, they are columnar, intercalated, squamous, or better still, low cuboidal. Okay. But the sinus cells or secretory cells are cuboidal. So you can have this as well. Now, this is going to describe how you can have a mixture of secretions. Like we have seromucous, okay, like the submandibular and then the sublingual glands. So if you say you have a mixture of mucous and serous, secretory portions, we mean that a portion of your manufacturing unit contains what? Mucous secreting cells, and then portions of it also contain what? Serous secreting cells. And this is how they are arranged. You have the mucous one, okay, closer to the duct, and then the serous ones usually cap or cover the ends of the mucus. So we say that it's a serous capping, okay, the mucus. And because the serous is capping the mucus, there's no way the cell can do 360 degrees, okay? So how it appears is like a half moon. So we call that a demi-lune. So serous demi-lune. Okay, that's the mucous, a sinus portion, and then the serous secreting portion. So here it is only serous. Here it is mucus. Okay, so you still have intercalated ducts and then striated ducts. Okay. So in a simplified diagram, this is what you have: the sinus, intercalated duct. So here you can see it's cuboidal. And then you have columnar here. And then now when you extend beyond the striated duct, you have interlobular ducts. Okay, and these are more squamous in shape. So how do these seromucous glands appear? Okay, in a micrograph. Remember, mucous secreting cells don't pick up much of the stain, so they will look whiter, okay, or less stained. Serous ones are very deep, but they pick a lot of stains. So you have serous cells here, and these areas that are not picking much of the stain, that look a bit pale or white, will be the mucous secreting cells, okay? So here, submandibular and sublingual, you can see that both have the serous component and the mucous component. However, when you look at the distribution, you realize that if you take submandibular here, you are seeing that's a few of the mucous and then you have more of what? Serous. And when you look at this part, you rather have more mucus and then what? Less serous. Okay. So submandibular has more of the serous than the mucus. Sublingual has more mucus than serous. So you can have a similar one like this too. So submandibular there, then sublingual. Okay, so in the drawing that we saw the seromucous with the serous demilune, you saw this. So that's serous demilune. That is mucus acina. That is the lumen that will lead to the intercalated duct, then continue to the striated duct. So you can see that very, very clearly. So that is parotid gland. We said it is purely serous, so we don't expect to see any mucus secretion or lighter staining. But somebody will say, hey, hold on, I can see a lot of light staining areas. Yes, you can see a lot of light staining areas, but these are not mucous cells. These are adipocytes. Adipocytes, the fat storing cells. So when you look at here, you see that it's almost entirely serous. Okay, so this is an adipocyte, right? Good. Then we have the lip, which has an oral side, a skin side, and then a vermilion border side. Okay, so the oral side is the one that will be closer to the teeth. Then the skin side is the one which is exposed to the environment. And then the vermilion border is where the ladies usually put their lipsticks. Okay, now each has its own components. Obviously, you expect that you have hair on the skin side, which is exposed to the atmosphere, but you don't expect to have skin within the part that is closer to the teeth. Can you imagine somebody opening their mouth to say hi, and then you see a lot of hair there? No. So you have vermilion border here, okay, which also has its own peculiarities. Obviously, you don't want to see hair follicles there also. Okay, then here you can see glands, okay, salivary glands in the oral mucosa side. Okay, all right. So there you have it. And you expect to have stratified squamous, okay, keratinized epithelium in the lip. So you can see salivary gland and the duct. That's a salivary gland, and then you have some ducts. Okay. Oh, these are glands. Those are muscles. Glands, muscles, muscles, glands, glands, connective tissue. Okay. Lining, or this time around to be a covering epithelium, depending on where you are looking at. If it's the oral side, then it will be lining. If it's the one exposed to the environment, that will be covering. Okay, and a vermilion border also be shown. Absence of salivary glands in the vermilion border. So you see, you don't have salivary glands at the vermilion border. You have dilated veins and venules in the lamina propria. You have tall dermal papillae with rich supply of capillary. That is why people who are fair usually see their vermilion border very reddish. Okay, yeah, which has become cosmetically attractive now, that people who even have dark lips want to have vermilion borders which are, reddish. They apply all sorts of things to get that appeal. All right. So I will end with the intro to the esophagus. So that will be for part 1 for today's lecture. Then we continue. So I'm going to say that the esophagus is about 25 centimeters long. It has a cervical part, thoracic, and abdominal part. I mentioned this in the early part of this lecture. And then we will zoom into the esophagus very well in the next lecture, because it's a complex area where we will need to know where you have smooth muscles only, where you have a mixture of both smooth and skeletal muscles, and where you have skeletal muscles only. I want to thank you for your attention so far, and we are going to meet again very soon. Thank you.